Did you know that anxiety disorders are the most common mental health issue in the United States, affecting over 40 million adults? That means that the person sitting next to you on the bus or in class may be silently struggling with anxiety every day. Anxiety is a normal human emotion that we all experience from time to time. It's our body's natural response to stress, danger, or uncertainty. For example, it's common to feel anxious before a big test or job interview or when facing a new or challenging situation. However, for some people, anxiety can become overwhelming and interfere with daily life. Anxiety disorders are a group of mental health problems that cause people to worry, fear, or feel nervous all the time. Many people still struggle to understand and cope with their anxiety. In this video, we'll talk about the different kinds of anxiety disorders, what causes them, and how to deal with anxiety and improve your overall health. Anxiety is caused by a complicated mix of genetic, environmental, and neurobiological factors that work together. Studies have shown that anxiety disorders may run in families, which suggests that they are partly caused by genes. Some genes may make people more likely to get anxiety by changing the way the brain works and how it reacts to stress. Anxiety disorders can also be caused by things in the environment, like trauma, abuse, and long-term stress. These things can change the structure and function of the brain, changing how it reacts to stress and making anxiety more likely. In terms of neurobiology, anxiety is linked to problems with how the brain responds to fear and stress. The almond-shaped amygdala in the brain is a key part of how we deal with emotions, especially fear and worry. When someone has an anxiety disorder, their amygdala may be overactive, which makes them react more strongly to things they think are a threat or stressor. Other neurotransmitters, such as serotonin, norepinephrine, and gamma-aminobutyric acid, also play a role in anxiety. Imbalances or dysfunction in these neurotransmitters can contribute to the development of anxiety disorders. Anxiety disorders are real medical problems that can be treated with medication, therapy, and changes to how you live your life. Anxiety can manifest with both physical and emotional symptoms. The physical symptoms of anxiety can include rapid heartbeat and palpitations, sweating and shaking, shortness of breath and hyperventilation, nausea and stomach upset, tension, headaches and muscle tension, fatigue and lethargy, insomnia and difficulty sleeping. The emotional symptoms of anxiety can include excessive worry and fear, panic attacks and feelings of dread, irritability and agitation, difficulty concentrating and focusing, restlessness and feeling on edge, avoidance of certain situations or people, negative self-talk and self-doubt. It's important to note that everyone experiences anxiety differently. And some people may not have all of these symptoms. Additionally, some symptoms may be more pronounced with certain types of anxiety disorders. For example, panic attacks are a common sign of panic disorder. While people with social anxiety disorder often act in ways that try to avoid social situations, there are many factors that can affect anxiety. Genetics. There is evidence to suggest that anxiety disorders may run in families. Certain genes may predispose individuals to anxiety, although environmental factors also play a role. Environmental factors. Environmental factors such as stressful life events, trauma, and chronic stress can all contribute to the development of anxiety. Brain chemistry. Neurotransmitters in the brain, such as serotonin, dopamine, and norepinephrine, play a role in regulating mood and anxiety. Imbalances in these neurotransmitters can contribute to anxiety disorders. Personality traits. Certain personality traits, such as neuroticism or a tendency towards negative thinking, may increase the likelihood of developing anxiety disorders. Medical conditions. Certain medical conditions, such as thyroid disorders, heart disease, and chronic pain, can contribute to the development of anxiety. Substance use. Substance use, including alcohol and drugs, can increase the risk of developing anxiety disorders or worsen existing symptoms. It's crucial to keep in mind that anxiety is a complex condition that is subject to a variety of influences. Lifestyle practices can have a significant impact on anxiety. Here are some ways lifestyle practices can affect anxiety. Exercise. Regular exercise has been shown to reduce anxiety symptoms. Exercise can help to reduce stress hormones, increase endorphins, and improve sleep, all of which can help to alleviate anxiety. Diet. A healthy diet can also have a positive impact on anxiety. Eating a balanced diet that includes plenty of fruits and vegetables, whole grains, lean proteins, and healthy fats can help to regulate mood and reduce inflammation, which can contribute to anxiety. Sleep. Poor sleep can exacerbate anxiety symptoms, while getting enough quality sleep can help alleviate them. Establishing a regular sleep schedule, practicing good sleep hygiene, and addressing underlying sleep disorders can all help to improve sleep and reduce anxiety. Stress management. Chronic stress can contribute to the development of anxiety. Practicing stress management techniques such as meditation, deep breathing, yoga, or journaling can help reduce stress and anxiety. Substance use. As mentioned earlier, substance use, including alcohol and drugs, can increase the risk of developing anxiety disorders or worsen existing symptoms. Avoiding or reducing substance use can help to improve anxiety symptoms. Social support. Strong social support networks can help reduce anxiety. Spending time with friends and family, participating in group activities, or seeking support from a therapist or support group can all help to alleviate anxiety. It's important to note that while lifestyle practices can be helpful in managing anxiety, they may not be sufficient on their own. Anxiety differs from normal worry and stress in several ways. Intensity. While worry and stress are normal responses to challenging situations, anxiety is often more intense and can feel overwhelming. Duration. Normal stress and worry are typically short-lived, whereas anxiety can persist for long periods of time, often with no clear trigger. Scope. Normal stress and worry are usually focused on specific situations or events, whereas anxiety can be more generalized and affect various areas of life. Physical symptoms. Anxiety can cause a range of physical symptoms, including sweating, rapid heartbeat, and shortness of breath, which are not typically associated with normal stress and worry. Interference with daily life. Normal stress and worry may interfere with daily life to some extent, but anxiety can significantly impair a person's ability to function in their personal and professional life. Overall, stress and worry are normal and even important parts of life. Anxiety, on the other hand, is a more serious and long-lasting problem that needs professional help to deal with. Different categories of anxiety disorders. There are several different categories of anxiety disorders, each with their own unique symptoms and diagnostic criteria. Here are brief descriptions of some of the most common types. Number 1. Generalized anxiety disorder. Generalized anxiety disorder is characterized by excessive and persistent worry and anxiety about everyday events and activities, such as work, health, and family matters. People with generalized anxiety disorder often have trouble controlling their worry and may experience physical symptoms such as fatigue, muscle tension, and difficulty sleeping. Number 2. Panic disorder. Panic disorder is characterized by recurrent, unexpected panic attacks, which are sudden periods of intense fear or discomfort that reach a peak within minutes. Panic attacks can be accompanied by physical symptoms such as chest pain, sweating, and trembling. People with panic disorder may also experience anticipatory anxiety, worrying about when the next panic attack will occur. Number 3. Social anxiety disorder. Social anxiety disorder, also known as social phobia, is characterized by intense fear and anxiety in social situations. People with social anxiety disorder may fear being judged or embarrassed in social situations, and may avoid social situations altogether. Physical symptoms such as blushing, sweating, and trembling may also occur. Number 4. Specific phobias. Specific phobias are characterized by intense fear and anxiety in response to a specific object or situation, such as heights, animals, or flying. People with specific phobias may go to great lengths to avoid the object of their fear, and may experience physical symptoms, such as sweating, rapid heartbeat, and difficulty breathing. Number 5. Obsessive-compulsive disorder. Obsessive-compulsive disorder is characterized by recurrent, intrusive thoughts or obsessions, and repetitive behaviors or compulsions that are performed to reduce anxiety. People with obsessive-compulsive disorder may feel compelled to perform certain rituals or behaviors, such as counting or checking, and may experience distress if they are unable to do so. Number 6. Post-traumatic stress disorder. Post-traumatic stress disorder is characterized by intrusive and distressing memories, thoughts, or dreams related to a traumatic event. People with post-traumatic stress disorder may experience symptoms such as flashbacks, avoidance behaviors, and hyperarousal, and may have difficulty sleeping and concentrating. Drug therapy can be an effective treatment option for anxiety disorders, but it's important to understand the benefits and potential risks of these medications. There are several types of drugs commonly used to treat anxiety disorders, including Antidepressants, benzodiazepines, and beta blockers. Let's take a closer look at each of these. Antidepressants are a type of medication that is commonly prescribed for anxiety disorders. These medications work by increasing the levels of certain chemicals in the brain, such as serotonin and norepinephrine. Commonly prescribed antidepressants for anxiety disorders include selective serotonin reuptake inhibitors or SSRIs, and serotonin norepinephrine reuptake inhibitors or SNRIs. Benzodiazepines are another type of medication commonly used to treat anxiety disorders. These drugs work by enhancing the effects of a neurotransmitter in the brain called gamma-aminobutyric acid, which helps to reduce anxiety. However, benzodiazepines can be habit-forming and can lead to withdrawal symptoms when stopped. So they are usually prescribed only for short-term use. Beta blockers are a third type of medication used to treat anxiety disorders. These drugs work by blocking the effects of adrenaline in the body, which can help to reduce physical symptoms of anxiety such as sweating and trembling. Beta blockers are often prescribed for performance anxiety or social anxiety disorder. While drug therapy can be effective for anxiety disorders, it's important to understand that these medications may have side effects. Common side effects of antidepressants include nausea, headaches, and sexual dysfunction. Benzodiazepines can cause drowsiness, confusion, and dizziness. Beta blockers can cause fatigue, cold hands and feet, and nightmares. It's also important to note that drug therapy is not a one-size-fits-all approach. Different people may respond differently to different medications. And it may take some time to find the right medication and dosage that works for you. Additionally, drug therapy is usually most effective when combined with other forms of treatment, such as therapy or lifestyle changes. There are several supplements that have been studied for their potential role in reducing anxiety. Omega-3 fatty acids. Omega-3 fatty acids, found in fish oil supplements, have been studied for their potential role in reducing anxiety. They may help reduce inflammation in the body, which can contribute to anxiety. Magnesium. Magnesium is a mineral that is involved in many bodily functions, including regulating mood. Some studies have suggested that magnesium supplements may help reduce anxiety symptoms. Valerian root. Valerian root is an herb that has been traditionally used for its calming properties. It may help reduce anxiety and promote relaxation. Lavender. Lavender is an herb that is commonly used for its calming properties. It may help reduce anxiety and promote relaxation when used in aromatherapy or as a supplement. Ashwagandha. Ashwagandha is an herb that has been traditionally used in Ayurvedic medicine to reduce stress and anxiety. Some studies have suggested that it may be helpful in reducing anxiety symptoms.